Today we're talking about long COVID in kids. I'm joined by Dr. Melanie Hoppers, a board-certified physician in both adult internal medicine and pediatrics. Dr. Hoppers works with the Bateman Horne Center, which is based in Utah, and focuses on taking care of patients with ME/CFS, fibromyalgia, and now long COVID. She is also the parent of a child who has ME/CFS, and it was actually her experience that led Dr. Hoppers to focus her medical practice on patients like her own daughter. In our conversation, we talk about the ways long COVID presents in kids, what they are facing in terms of obstacles to care in medicine, and what actually works to help kids who have long COVID. We also talk about the difficulties or challenges that we as parents face trying to understand what our children are experiencing, particularly when they might not be able to put into words what they are feeling or suffering from. It's complicated to be a parent. It's extra complicated when you have a child who's developing an illness that you don't fully understand. I appreciate Dr. Hopper's voice and advocacy in this space, and I'm so happy and excited that you get to hear her voice as well. Without further ado, here's my conversation with Dr. Melanie Hoppers. Dr. Melanie Hoppers, thank you for joining us and welcome to Long COVID MD.
Thank you so much. I'm very happy to be here.
I'm so pleased that you're here as well because you have a wealth of experience, background knowledge on things that I frankly don't and so many people need. You are boarded and trained in internal medicine for adults and pediatrics, and your practice is focused on primarily helping people who have children with post-viral illness and ME. But why don't I ask you to explain who you are and what your medical practice is like?
You're doing a great job. I'm trained in pediatrics, board certified and trained in internal medicine. And I trained in Tennessee, and I stayed here and started a practice when my kids were little. I did mostly urgent care. And as they got a little bit older, I transitioned to primary care and then did that until my daughter developed ME/CFS. And not at first, I still practiced for a few years, but as she got sicker, I slowed down quite a bit. I still dabbled and did some things, but I wasn't really full-time taking care of patients until about 21 when, as I was finally wrapping my head around this disease and trying to learn more about it, I realized it's not as rare as I think it is, or as rare as I thought it was. And I thought it was rare because good luck finding any care for your kid with ME/CFS. And so, long story short, I realized it's not that rare. There are people helping. I have to help. There's not, I hate it that it's me. It should be someone much better. It should be, someone at a big name institution with all these letters behind their name. But I'll show up and do the job too. So that's how I ended up taking care of people with ME/CFS. And I take care of adults as well, but I do love taking care of kids.
Can you tell us a little bit about your experience as a parent of a child with ME?
Oh, sure. It's very hard. It's very frustrating. It's also very inspiring. And that's from both my daughter and my patients. I have said numerous times that these are the best people that exist on the planet. I firmly believe that. And their resilience and their bravery amaze me. Certainly they have better qualities than I do for sure. it's been very, very frustrating in that, as I alluded to earlier, when my daughter first got sick, and I was just wrapping my head around it, right? It started with mono, and she was doing the mono things. She's tired. She doesn't feel well. Okay, that's sort of normal after mono. And oh, wait, 6 months later, gosh, this is kind of going on a while. But I've seen patients who, stayed sick this long. Okay, it's going to be okay. And, a year goes by and I'm like, wait a second, what's going on? And, I took her to primary care and they were very attentive and very concerned and, sent her to a big name institution. And not that they were unkind, but they just we were telling the symptoms. She does this and then she comes home and can't do anything for 2 weeks. I told them how we went on vacation to Disney World. She stayed in the hotel. And when we, she didn't get to go to the parks. It's not like I'm trying to avoid school and I'm great on the weekends. It's, I'm not doing the fun things. And they just didn't know about the disease. I even mentioned at one point, I think she has this disease, and it's in her note that mom thinks she has this, but there was never any more mention of it. So I think it was just they didn't know. But it's very frustrating. So then I started looking. I got on the internet, where can you take your kids? And there's a wonderful doctor. His name is Dr. Peter Rowe, and he has a clinic in, I believe where is it? It's
in Baltimore.
In Baltimore. And he is such a lovely person and so smart. It was in the middle of COVID, and at that point, they're overwhelmed. They're about the only place you can take your child. They're not. I'm sure there's some others, but that's all that I could find. They were closed to new patients. So understandably so, but he has this great primer you can read. So, I understand he can't see 1 million patients. So, but the point of it is there's nowhere to go for help. There's just nowhere to go for help. Now, I did finally find, I guess at this time my internet sleuthing skills weren't very good because it took me a while, but I found the Bateman Horn Center. And I did find help with them, and they helped me to learn about the disease and helped to train me to care for people with the disease. So they do great work. And now I'm at the Bateman Horn Center.
So you work with Bateman Horn now, which was it's a medical establishment or clinic that was started by Dr. Lucinda Bateman, named in honor of her sister who struggled with ME. And she has focused her practice on taking care of people with ME, fibromyalgia, and now long COVID. And you work as one of the consultants there. What are you seeing since the COVID pandemic in terms of kids? Like, how many kids are affected? I know it's kind of a tough to collect data on this.
Oh,
I guess, what are you seeing? How are you seeing the kids present?
So it is tough, right? And I like to know how many kids have long COVID. And recently I did a talk and I had the latest data, and it said 5.8 million children have been affected by long COVID. Maybe not active at that moment, but 5.8. Then I saw a recent article that came out this year this month. It said 1 million children. So what a huge disparity. Yeah, I really need to read the article so I know where I think the truth lies. 5.8 is a lot. I hope it's only 1, but wish it were 0. But it's probably somewhere in between. And how do they present? So, interesting question. First of all, more than anything, I see adolescents, but I'm not sure that that's because we just aren't recognizing it in children. I don't have a general pediatrics practice, so if I see someone, they're referred to me for the suspicion of long COVID. So someone has to think of that, right? Mm-hmm. In kids, a lot of times kids' COVID infections are asymptomatic. And so they may have a little cold, little sniffles, congestion, what have you. And 2 months later, now they're having attention issues and they're not doing well in school. And they come home and they lay down when they get out of school. And on the weekends, they're laying around, not playing and doing things. And no one really puts that back together to, 2 months ago, they were a little congested. right? Hard to prove. They may not have gotten a test. So you really have to be acutely looking for that, to piece that together. And one of the ways I piece it together is, what are the symptoms? They're going to have sleep issues, whether it's they are sleeping too much, or when they sleep too much, and then when you try to get them up, it's hard to wake them. They aren't rested. They're still tired, or they can't sleep, or they're up 3 or 4 times a night. I'm seeing a lot of neurological issues, a lot of headaches, a lot of kind of brain fog, attention issues. I am seeing also patients who have who've been completely healthy, no prior history, no family history, who are coming in with very severe depression. Even I've had a patient, I've had some patients with some neuropsych issues that are very scary. I had one patient who had, and I have permission to talk about her. She had some what were described, and I hate this term, it's psychogenic non-epileptiform seizures. Now, I'm going to only say that one time. I'm going to say she had non-epileptiform seizure activity because I don't like that word. And anyway, we can talk about that another day. But I think it gives you a really bad connotation, whether it's intended or not. Anyway, this person, I'll tell you a little story about her real quick. Sorry, but
no, please.
I got the paperwork, the little packet that I sent out. What's going on? They sent me the information back, and I was like, oh gosh, I was new, right? I was new to this. And I thought, I can't do this. This is too hard. I can't take care of this patient. She is beyond my ability. But she has been to several children's hospitals. They said she had the psychogenic, I said the word again, I messed up, but the non-epileptiform seizures, nothing to do here, get some psychiatric help, all will be well. So again, I was like, I don't think I can do this. And I thought, wait a second, who's going to? If I don't do it, who is going to do this? So I said, okay, I will try. I'll see you. Let's try. So saw her the first time. And what was going on was she was having these episodes 20 to 30 times a day. They were seizure-like. She would fall and hit herself, hit her head. It was not a joke. It was not something mild that was going on. Long story short, mast cell treatment almost completely resolved this. And so mast cell activation, neurological symptoms, attention issues, and a lot of GI symptoms are another issue that I see. A lot of nausea, vomiting, diarrhea, constipation, rashes, sensitivities to food. It's really all over the map, right? But one of the things that I have noticed that I feel like I see in kids and especially adolescents is, and this is not a medical term by any means, but I feel like they look like they're on fire from the inside out. They just look hypervigilant. They sort of startle easy. They just look, they're looking around. They just look like they're in a constant state of what's the word I'm looking for? Of just being activated. And the interesting thing about long COVID is when you see patients with ME/CFS that had it prior to COVID, that wasn't on our radar. They got mono, they might not get diagnosed for 5 or 6 years. By then, some of this has calmed down. Or maybe I don't know if this happened, right? You can't go back and relive that first year. You can't necessarily, this is something I observe. I can't observe them in that state of I just got sick from mono and now I have this illness. And so I don't know if it's different or not, but that's one of the things I see with long COVID is it seems to me that there's a lot of neurological symptoms and a lot of just looking like they're, again, I hate to use this word because it's so non-medical, but they just look like they're on fire and they need some help calming down that autonomic nervous system. They're having nightmares, just they startle easy, they get very anxious, but understand that's most likely, a lot of it is due to orthostatic intolerance. Orthostatic intolerance can make you have symptoms of anxiety. So please be clear that I'm not saying that anxiety is causing the illness, because that is not at all what I'm saying.
Yeah, there is. So it really, what's hitting me from listening to you is that you have to have a high index of suspicion for an infectious etiology when you see these generalized and what sounds like really scary symptoms that can be confusing and worrisome both for the patient to experience and for parents to witness. I am wondering, we've talked about ME and we've said long COVID. And you talked earlier about your own daughter having mono. I know that, at least according to one study that I recently read, up to 23 to 25% of college kids who catch mono end up with an ME/CFS diagnosis at 6 months or meet criteria. I have a couple of questions for you. One is the post-COVID symptoms you're seeing in children very similar to ME? And two, does ME in children have the same diagnostic criteria as in adults? Does it have, I know the presentations you were talking about can be different. We had Amy Mooney, occupational therapist who also works with Bateman Horn, who is also a parent of a child with chronic illness. And she was sharing with us that a lot of post-viral illness in children presents with GI symptoms, as you were talking about, which isn't necessarily the way it presents in adults predominantly. So can you tell us, is long COVID in children ME, and what is pediatric ME?
Mm-hmm. Okay, so I have a slide. We're not visual. So that's an interesting question. The question is, do the patients with long COVID meet criteria for ME/CFS? So it gets kind of confusing, right? I use the 2015 NAM criteria for ME/CFS, and for kids as well as adults. And I talked to Peter. I go back to Peter Rowe. That's the same criteria he uses.
And that's the National Academies of Engineering and Medicine.
The Institute of Medicine, now known as NAM, but it was Institute of Medicine when they did the criteria.
Okay.
So that's your criteria. Patients with long COVID, the definition is not the same, right? It's, I've had COVID 3 months later, still having symptoms. It can be something as, I shouldn't say minor, but it can be something that only is loss of smell, which can be very terrible for the person experiencing that, all the way to a person who is completely bedbound. So huge range of symptoms, but only those that meet that criteria for ME/CFS will be classified. So what you have, and I have this little slide schematic, and it starts out with you had a person who gets COVID. A child gets COVID, so they have an acute infection. Then what can happen is they resolve, 80% resolve. 10 to 20% will develop symptoms of long COVID, and they will meet the definition of long COVID. So now they also meet the definition of a infection-associated chronic condition. We're starting to use that term because at the top, remember I said acute COVID infection, well, that could be a mono infection. That could be, I had a whiplash injury. It could be surgery, or it could be Lyme, or I said infection. So it could be some sort of infection, whatever the source is, right? So in the case of mono, like you said, about 80% recover. Similarly, COVID, about 80% recover. And I'm talking about kids. 10 to 20% develop that. Now I have the definition of long COVID or post-viral illness. So you have mono, you don't meet criteria until you've been sick for 6 months. So in kind of that interim, you may meet the definition of post-viral illness. Then from there, some people resolve, Some people go on and continue to have long COVID symptoms. And then some people now at 6 months meet that criteria for ME/CFS with the fact that they have, 50% functional ability. They are affected at least 50% of the time. They have sleep issues, orthostatic intolerance, all the criteria, right? So the question, though, is what are the numbers? I don't know. I've tried to find this out. There's maybe 1 or 2 studies, and they only go out. I believe the longest I have seen is 6. I know that there's been one at 6 months. I think there's been one at 1 year, and it's to me, very unclear. We really don't know. I suspect it will be similar to mono or to the other things that have caused ME/CFS. So before the pandemic, there were about 300,000 people with ME/CFS. Now I was looking, again, I told you I've seen ranges of 1 million to 5.8, which is a huge range for long COVID. And if you even had 10% of that, think of the numbers that have gone up when you already don't have enough providers. And now all these additional kids having long COVID and potentially ME/CFS. And get this, it's a spectrum, right? If you have long COVID, but you don't meet criteria for ME/CFS, it doesn't mean you don't have problems. You have problems, right? It just means that the severity of your problems is not quite as high. But you still need help, and we still need providers for you. This is why primary care has to be involved. Pediatricians have to be involved. And it's really not that hard. They can do it. And I'll say this, and I'm jumping ahead now, and I can stop if you'd like.
No, please.
But one thing that parents can do, I know there are parents out there going, I've taken them to primary care, I've taken them to the pediatrician, I've taken them to the ER, I've taken them, and nothing is happening. I'm getting blown off. There are things you can do, and the most important thing you can do that does not require a medical degree is to help your child to pace, to stay out of post-exertional malaise. For those who aren't aware of what that is, it's when you're ill with a post-infectious illness, you have a limited amount of energy. You cannot produce the same amount of energy that you once could. And so if you exceed that limit and you push to get through activities, whether it's physical activities, whether it's cognitive activities, social activities, hanging out with friends can be fatiguing. Environmental activities, if you go out to eat in a crowded restaurant, it takes more energy than if you sit at home with your family and eat. All of those things are things that consume energy. So when you get past your new limit, then you pay for it. You will see your child not want to do anything. They want to do something. They can't do anything. I should say they can't do it, right? They'll be on the couch. They'll say their stomach hurts. They'll say they're tired. I don't feel good. And you're thinking, because this is what I was thinking, do you have a sore throat? Yes, frequently they will have a sore throat. They may have a low-grade fever. My poor child has been swabbed for strep, I bet you 1,000,000 times. Sometimes it's positive, sometimes it's not. But a lot of times you would find yourself at urgent care a lot or going to the doctor a lot because you think they're sick. They are sick, but it's a different kind of sick. If you notice at the end of the school week, my child kind of has to pay back and spend the weekend resting so that they can get up and go to school on Monday. Or they come home and they take a 3-hour nap, eat supper, and go back to bed. Those are things, they're giving you an indication that they're in post-exertional malaise. So you have to find ways to reduce their energy consumption. And so you want to, advocate with school, have conversations with the school about accommodations, modifications. And now here is where you will have to work with your provider, but also making accommodations at your home. It's really hard being a parent trying to understand PIM. And I'm going to see if I can explain this. I tried to think about how to explain it the other day. So you, Dr. Kahn, know about PIM. You've experienced PIM. no one knows how you feel except for you. But you are fairly autonomous in your schedule, right? I mean, granted, a person who goes to work, they have to go to work, whatever, but there's some autonomy in that. I understand people have to eat and, make a living, and sometimes there's no way to reduce their activity, et cetera. But in general, adults are more autonomous. Kids tell their parents, I don't feel good, I need to stay home, right? And they get to the point where, you're starting to get to that point where you've missed too many days. We can't miss a day. You've got to go to school. But they don't know how the child is feeling. They may not be able to express adequately what's going on with them. And so they're having to help. Adults find it hard enough to pace. How do you pace your kid when you're not in their body? Does that make sense? It sounds kind of weird, but, a person who is trying to pace can look at, I feel short of breath, I feel chest pain, I'm getting heavy limbs, whatever, those kind of symptoms. I know I need to slow down. Well, with kids, they may only say, I don't feel good, I'm tired, I don't want to do that, I have a headache. When they're doing homework, they may say I have a headache, but really it's they can't think. They can't put another problem out there. They're having cognitive fatigue. And so it's just really hard for parents. But if you can help your child pace, that's really helpful.
Wow. I never thought about the headache and cognitive fatigue, overlapping. And I think what you're speaking to is trying to understand the needs of the child in your charge. Like when you're a parent, you're trying to figure out what is normal and what is a normal childhood, what is normal behavior. And it's a learning curve for us as parents. Even if you have more than one kid, each child is a little different. And you're sort of trying to translate the language that they're using into what you know as an adult, and then sift through your possible responses. Do I need to push this child and encourage them to continue doing it? Is this when I, make them sort of rest? We have a lot of challenges, both as parents and I imagine as physicians too, deducing what is within scope of normal and when things are a problem. And one thing that has come to my mind, not only with kids but with adults, is when do we believe them? We have a tendency to sort of dismiss adults when they have symptoms that we as physicians don't quite understand. But with kids, we do it so frequently. Like, I've been learning more about sensory integration and sensory processing. And I heard someone say that, you have a little kid who's just getting used to wearing shoes and they're showing you that it's not comfortable. And what our tendency is like, just suck it up and walk. It's just a pair of shoes. But their experience is real. Can you talk to me about how you were able to interpret your child so that you could advocate for her properly? And what do you see other pediatricians doing? What do you see other parents doing? That's like a huge area of importance for children.
This is probably the hardest thing. It took me a minute, and when I say minute, I'm being facetious, to wrap my brain around PIM. I had not heard of PIM when I experienced it with my child. And Monday, sure, baby, let's stay home and rest. Tuesday, we've got to go to school. I was all over the map. And I went from, okay, this is ridiculous, you've got to go, to to being up at 3 a.m. going, what is wrong? I don't understand. would recommend erring on the side of doing less. And the reason why I say that is we talk about encouraging them to stay in school. Yes, school. One of the predictors of, oh boy, I can't remember exactly. I don't want to say something incorrectly, but one of the things we really like to do is advocate for them to stay in school. We absolutely want them to stay in school if at all possible. However, if you have a patient, I have a patient who was really struggling, and I kept talking to the parents, let's please consider, pulling them from school. Let's do homeschool. Let's do can we do homebound, what have you. The school really gave us a hard time. They didn't cooperate. So the parents felt pressured, continued to push a little bit. The child's now not able to attend school, and I get wanting to encourage. That's what we have learned our entire lives. My background, my generation, you suck it up and you do it. And, you go and you don't stop. And it's really hard to wrap your brain. It's hard for anybody to wrap their brain around pacing. I always say this too. If you're an adult and you're 30 years old and you've been going to the gym for the last 4 years, 3 times a week, and now over a couple of months' time, all of a sudden you're no longer able to go to the gym without feeling like you have the flu, it may take a little bit for you to figure out what the problem is, because just the history is I go to the gym, I feel better I don't have this bizarre symptom of flu-like illness after I exercise. Why would I put that together? Surely I ran into someone at the gym who gave me an illness. It takes a little bit. Well, kids, it's just a whole other story. And now it's the parents trying to understand it, and they aren't even experiencing the symptoms. So err on the side of protecting your child. And the thing about it, one thing I didn't mention earlier with kids is I do see kids sometimes, it's more likely for me to see a kid get better than an adult. So
that's wonderful to hear.
Yes. So let them rest. Let them rest. As Amy and I have had this conversation, Amy Mooney, right? If they get well and they're doing great, we can put them back in school. We can catch them up. And I know, I know if you don't want to just take a child out of school who's not unhealthy. But so I'm not saying that as a general population statement, but in this population, let's protect their health at all cost. And we'll worry about the rest of it later. I wish I had known that with all of my soul. I wish I had known that. And I have a kind of a motto now. If I see that someone, especially, I try to do it with every patient I have. If I see that they're pushing and pushing, I'm going to yell fire. And I don't want to sound like I don't want them to lose confidence in me. It sounds almost like, well, your kid can't do anything or you can't do anything. It sounds like I'm trying to keep you down. It's not that. It's that I'm trying to protect you because I have seen the after effects in not just at home, but in my patients, in those who just either can't slow down because they're the sole breadwinner and they have to keep working. There's not a good system in place to protect people. Or they can't accept it, or whatever the reason, and then finally their body chooses for them. And so, my goal at the end of the day is to preserve function. We want to preserve function.
Yeah, I think you're speaking to the fact that none of this is ideal, and we're fighting a healthcare structure that is not designed to recognize or treat kids like this, and a school system that isn't designed to accommodate kids who really need this. Like you said, we know school is beneficial for kids in the larger demographic, but in this subset, what we need to focus on is health and well-being before we can even tackle the academic stuff. Talk to me a little bit as we wind down here about the treatment options for kids with long COVID and ME, and what are some of the challenges that parents face and physicians face when they're trying to find adequate treatment for these symptoms.
Okay. So I think the biggest challenge is finding someone who will see your child. Or I shouldn't say that, they'll probably see your child, is to get them to address the conditions at hand. It's, again, like I said, it's hard and it's not that hard. There's the first thing is support them with pacing. The providers, if you can just ask your provider to read about post-exertional malaise and help them with, if the provider will help with accommodations, with modifications, with intervention with the school, with supporting you to get that to happen. The other thing they can do is look at orthostatic intolerance. Almost a huge number of patients with ME/CFS and long COVID have orthostatic intolerance. There's things that you as a parent can do without a prescription. You can do, and you can get on the website to look, but you're going to increase your salt and water intake. Wearing compression clothing, doing accommodations. Don't take your kid with you to a store where they have to stand for 45 minutes. Help them with accommodations at school. Do they need a stool to put their legs on? Do they need rest breaks where they can lie down flat in the nurse's station? Whatever, things like that. So that doesn't even require a prescription. But for providers, I have a lovely Echo Talk that it goes through, here's, step 1, 2, 3, 4. Dr. Rowe has a wonderful book. I really have never met Dr. Rowe. He has not paid me to advocate for anything. But he has a great book about orthostatic intolerance, specifically in kids. And it's not hard. It's things that we use, it's not these medications that are just off the wall. It's, beta blockers in some patients. I won't go into specific details, but there are medications that we use in kids for other things. And so, there are definitely things that can be done for that. There's also mast cell activation. Not all, I won't get into the whole mast cell controversy as to how you diagnose it and all of that, but patients with long COVID and patients with ME/CFS frequently have mast cells that are overactive. There are simple things. Eating healthy, eating food without dyes and preservatives, lowering your processed foods, avoid fast foods. Weirdly enough, avoid leftovers. If you have a meal that you're going to save, freeze it. Those are some simple things that can be helpful. You just think about mast cells react to anything foreign, and we have dyes in our food and such, and these things can be very reactive, especially not only in people with GI symptoms, but especially in people with GI symptoms. So just a healthy diet can be changing for a patient. Let me think. Sleep issues, that's another thing. Sometimes as physicians, we will support our patients in helping them get sleep. And as a parent, there are activities you can do, limiting screen time at bedtime, doing things to activate the vagal nerve, doing relaxation exercises, things like that to help with sleep. Again, there are things that are non-prescription that can be very helpful. So even if you can't find a physician or a provider who will assist you, there are things that you can do. I don't want you to feel helpless. Go to our website at batemanhorncenter.org. And, there's all sorts of resources on there that can be helpful.
I'm going to link the Bateman Horn website and the resources that you've mentioned from Dr. Rowe as well in the show notes. I'm hearing that there is hope for kids with long COVID. I'm also hearing just I don't think of our kids as a strain, but what an undertaking it is for parents to help their kids get better. It's so scary when you see your child sick. Modifying diet, modifying lifestyle, helping to teach your kid interventions like meditation and relaxation, that means you have to learn it too and take the time. And so I really hope that parents are able to replenish their energy stores also, because I can imagine this is not just a full-time job. This is emotionally and energy. It's taxing.
It's absolutely terrifying and difficult. But like I said, and as every parent knows, it's well worth it. They are well worth it. And I would just say, remember, it's a marathon, not a sprint. Do the best you can. Allow yourself grace. Don't beat yourself up. I remember one time we were doing something that my daughter really liked to do, and on the way home, I was thinking, I have really done it now, because I realized we went too far. We stayed too long, and I just, the whole drive home in my head, I'm just beating myself up. And so, but I learned from that, and I learned, okay, from here on out, when we do an activity, I have a time, and I decide ahead of time what I think is, and what I think is going to work for her. And I set a timer on my phone, and I give myself a 5-minute warning so I can give her a 5-minute warning. And then it's, okay, the timer's out, we're going, bye. That's just, there's no decision to be made. I made the decision before we left. So that was very helpful for me. Now, that was when she was a little bit younger. So the other thing that's very challenging is all of this evolves, because as they get older, now my goal in life is to help her learn how to manage her illness herself without my help, because, one day there won't be my help. So it's very complicated. It's very complicated, but
I think that describes parenthood in general.
That's
too.
True. It's very true.
But it's another level.
It's a whole different level.
Dedication. Melanie, what else that we didn't possibly cover that you think it might be helpful for listeners? Did we miss anything?
No, I think if you can find someone who is sort of in your shoes, I think that's really, really helpful. I have a few parents that I text, and today was a bad day, and, maybe that was their good day, and they can lift me up, and then I try to lift them up. The other thing is to try to find joy where you can, to try to find the ray of sunshine, because one day, and I'll give you this wisdom from my daughter. One day I was, kind of I was telling her I was sorry that all of this was happening. And she looked at me and she said, "But Mom, I'm so lucky. I can do this and this and this." And so, I guess my point is just try to find joy where you can, and just embrace it and let it wash over you, and bask in it, and give yourself grace. And we're out here doing the best we can to find answers. There are those, I tell you, the Bateman Horn Center, they work tirelessly to try to find answers.
We can learn so much from our kids. They really are our teachers as much as we think that those roles are reversed.
100%.
If we listen and pay attention to them. Well, Dr. Melanie Hoppers, thank you so much for sharing your time with us, for sharing your voice, for sharing your expertise. I have a lot of hope for kids who have been suffering with post-infectious illnesses like long COVID. I am really hopeful that we get some answers, and it's reinforcing a conclusion I have already come to, that we really need to improve medical education on long COVID to our to providers. And I thank the Bateman Horn Center for playing a role in that.
Yeah, that's another thing that I didn't mention earlier, is if you have a provider who is willing, there are so many videos, so many resources on our website. That is one of our missions. I mean, we see patients, but we see really a huge portion of our time is spent in education. So we are a resource. There are many, it's free and available to anyone who wants to look at it.
Oh, that's such a great reminder. Well, thank you again. I really appreciate it.
Oh, you're so welcome. Thank you for having me.
Oh, my pleasure. It's a gift that you've given to us. I want to thank Dr. Hoppers once more for joining us here on Long COVID MD. I hope you learned a little bit about long COVID in children. I wonder if you yourself are a parent of a child with long COVID. If you are, I am sorry. I know it is particularly heartbreaking to see your own child suffer. There are a lot of obstacles to care, but one of my takeaways from my conversation with Dr. Hoppers is that there is hope for our kids, that we need to really listen and tune in to what our children are trying to tell us, even when they don't have the exact words to describe what they're going through. What are the signs that they are demonstrating to us? How are they communicating to us non-verbally? I also feel reassured when she says to err on the side of rest. And I think that is something I'm going to take away when I approach my own kids when they have illness. The topic of school and time away from school is also one that really intrigues me. I don't know if you're a parent, have faced some pushback from keeping your kids home these days, but there is certainly a trend towards, some school administrations really pushing kids to be in the classrooms. As we discussed in this conversation, for all comers, truancy or time away from school can be detrimental. But what happens when your child is going to be harmed by the act and tasks required in getting up and going to school and spending a whole day exerting themselves physically and cognitively? That's a different calculation. The last takeaway that I have is that we as parents have to show ourselves grace. Parenting is challenging. We are bound to make mistakes. And in order to move forward, we have to be willing to forgive ourselves, learn, and pivot. That's true for parents of sick children. It is also applicable to those of us who are adults and are ill ourselves. Let me know what you think about Dr. Hopper's advice and insight. Do you have a child who is ill? What obstacles have you faced? What have been your successes? Reach out to me as always on email at longcovidmd@gmail.com. Follow me on Substack at longcovidmd.substack.com. You can sign up for my free newsletter where I summarize each podcast episode and send you the highlights so that you can have those as reference, or on those days where it's too tough to listen to a whole episode. I want to be able to keep you posted, to keep you aware of the issues that interest me, and I am assuming interest you, in whatever format works for you best. I appreciate your support. Please tell a friend about Long COVID MD. Your recommendations is what keeps this podcast growing and keeps it strong. Thank you again. I'm Dr. Zeest Khan, and you've been listening to Long COVID MD, the podcast. I hope you're feeling well in this moment, and if not, I hope you feel a little bit better in the next. Take good care, and bye for now.